welcome. So today we're going to talk about our second risk factor. Again, they're not in any particular order, but please go back and check out our other videos where we mention all the 5 risk factors, and we've already recorded and uploaded one of the first risk factors. So Joel joins me again to talk about this very important risk factor that we need to know about.
That's right, Sochi. Thank you again for having me in your program. And we're going to be talking about an important factor that's triglycerides. What exactly are triglycerides? They're actually the fat that is found in the blood. And where do triglycerides come from? From a diet that is high in sugar, starches, and carbohydrates. So we want to get deep into this to explain to the viewers.
Perfect. Unlike most people think that high cholesterol, in this case high triglycerides, come from fat, that is
that's not correct.
Not the case.
Not
and
the
we
case.
will go into depth about that in a little bit. But I do want to point out that at least one of the number one factor that influences an individual's heart disease risk is having high triglycerides.
Correct. And again, the reason why we're talking about this and triglycerides and the other factors of the lipid panel is to see how high a risk we have for cardiovascular disease, such as heart attacks and strokes. So this is why we look at it, and this is why we always mention the cholesterol, and that's should be an exam that's done typically by your medical provider to see what your risk factor is for cardiovascular disease.
Perfect. And then you'll talk about the frequency of how often we need to have it done. But 50% of individuals in the US and 40% worldwide have been diagnosed with high cholesterol. Obviously, specifically, we want to talk about the high levels of triglyceride. But to know that 50% of individuals in the US, that's a pretty staggering number.
Pretty staggering. And again, that is the triglycerides. Now, there is 4 components to the lipid panel, the ones that your medical provider will order typically. The first number is total cholesterol. The second one is HDL, which is quote unquote good cholesterol. The LDL, which is bad cholesterol. And I'll let you know the jury's still out on that. And then triglycerides. And triglycerides are so important. In fact, the 2 main factors I believe in the lipid panel that we need to focus on really is the triglycerides and your HDL. And I'll get into the ratio about that in a second.
Okay, so perfect. Another little number that I want to throw out there is that 2/3 of people who have had heart attacks have also been either diagnosed with diabetes and or have an undiagnosis of diabetes or pre-diabetes. So sometimes patients or families say, but it was just, there was no sign, and this is the reason why, because some of these labs or some of these other chronic diseases go undiagnosed.
Correct.
And then this thing happens, right? So it's kind of like our body, it's like we've kind of been letting you know there's been little signs here and there that maybe we avoided or just didn't go and get checked out, and then so here we are now experiencing a heart attack or a stroke, as you mentioned.
Correct. And as you mentioned, the triglycerides are linked to diabetes. In fact, there is a test that you can actually do and look at it to see what is your risk of insulin resistance, which is really pre-diabetes or diabetes, and this can be checked even 10 years before an actual diagnosis of diabetes. So what you do is you'll look at your panel and you'll look at the triglycerides, and you'll look at your HDL, which is your good cholesterol, and you can do the ratio of the 2. Grabbing the triglycerides, dividing by the HDL, and you'll get your ratio. And anything above a 3 means that you're in insulin resistance already. So that can kind of be another way to see if you're heading towards insulin resistance, or pre-diabetes or diabetes, and that's without even having to check your blood sugars, which you should get checked anyway. And this test usually is done typically every 3 to 4 months if they're not in range, to see if dietary changes, which is the main thing that fixes the triglycerides, to see if you are improving, so you won't be heading towards that insulin resistance that we're concerned about.
And can you give us a little bit of an example of what that ratio would be, like for individuals out there that maybe already have their labs on hand and they can go easily?
Real simple. Just grab a calculator if you're not a wizard in math. Which I'm not, by the way, so that's why I grabbed my calculator. What you'll do is you'll grab the triglycerides, and I'll give a typical number. If it's 100, your triglycerides, which actually is good because less than 150 is a good number.
Okay,
Divided by the HDL, let's say your HDL is 50, and that's really good in both males and females, because in males 40 and above is good, females 50 and above is good.
Mm-hmm.
You divide 100 by 50 and you'll get your ratio of 2, and that's actually pretty good. 2 or less is a good ratio to have, your triglyceride to HDL ratio.
Okay, perfect. That's, very important to note, and for us to kind of do our own little homework, right? Correct. If we already have that
and do that. And if your medical provider says no, your cholesterol is bad, and you show them that triglyceride to HDL ratio, not only will they be impressed, but you may actually teach your medical provider a thing or two.
It's so interesting that this is kind of like a predictor of, like you said, 10 years from now, and it's so like, if you're 30 right now, or if you're 40, do this now so that you know ahead of time, like, hey, I better, kind of make some changes so that I can prevent this and add to my life, right?
Correct. Yeah, and that's the main thing. We're doing this, to see if we run a risk factors of having a higher chance of probability of cardiovascular disease.
So I want to give a little bit of an analogy as to what this triglyceride to HDL ratio is, for people to kind of understand as to what happens. Because at the end of the day, obviously we can have these, heart attacks or strokes develop, but that's because of the excess plaque buildup, correct? That happens. So think of inside our bloodstream, we have these dump trucks, right? And so we've seen these dump trucks, we know what they look like, right? They have like this big box back, right? And then it should be picking up stuff. In this case, we will consider sand, right? So it's picking up sand. And so this ratio will help determine kind of how many of those trucks we have versus how much of the sand we can probably pick up. Correct. Right? Yep. And how much is going to stay there, right? If we don't have enough of these trucks. Correct. And or the size, because I think that's very important too, right? The size of this truck.
Yeah. So basically the truck is the lipoprotein. It's a coat that coats the cholesterol, because cholesterol and water don't actually mix. So you need to get on that dump truck, the lipoprotein, to be able to move from the tissues to the liver and to the liver and back, and depending on what you're consuming. But yeah, the size is the most important thing. The smaller the size, especially when it comes to LDL cholesterol, the higher the risk for developing plaques.
Wow, okay. And so, yes, there is a genetic component. So, of course, so we have immediate family members. I'm talking about mom, dad, brother, sister, maybe grandma, grandpa. There is that there, right? That can potentially affect us. And so if we don't have a healthy lifestyle, obviously we have a higher chance of developing these conditions, right? Correct. But mostly it is lifestyle. It is what we're eating. It is also, obviously our physical activity, but most importantly, and I hate using the word diet, but it is our diet. It is what we are consuming. So correct. Yeah. As far, just to add on that genetic component, genetic mainly affects the HDL. Okay, so that's more linked to genetic. The triglycerides are more what we're eating, and specifically the carbohydrates, the sugars are the ones that will increase it. And I want to make mention of this again, even though we have a video already specifically on that, but a person that has been diagnosed with metabolic syndrome, it kind of already immediately lets providers know that there may be a chance of high increased triglycerides.
It's part of the metabolic syndrome. Right. It's part of the 5 factors of metabolic syndrome. Correct. It's the triglycerides being high, the HDL low. So those two are 2 of the 5 components of metabolic syndrome. So again, our lifestyle. Unfortunately, we kind of follow the standard American diet, which is sad. Yes, it is. Think about it. I mean, the acronym to it is SAD, and it's and sometimes we don't know any better, right? And we think, well, this is kind of what the recommendations are, but the reality of it is that an excess consumption of starches, of sugars, of carbohydrates, are going to be the culprit of this excess triglycerides. The sad part is, going back on the SAD diet, We used to consume as humans about 4 pounds of sugar per year, and now the numbers, get this, 156 pounds of sugar a year.
Gosh.
This is the reason why we're seeing so many problems with metabolic syndrome, diabetes, prediabetes, hypertension, stroke, heart attack. 156 pounds compared to 4.
I'm just thinking of the sugar packet, you know, like the sacks or whatever they're called.
Correct.
I'm thinking of them all lined up and adding up to the 156 pounds. That's a lot. So even that, think about that. Picture that. This is the amount of sugar some people consume.
Most on the standard American diet, especially the processed diet, yeah.
Well, here's some numbers for you. It's 88% of U.S. individuals in the U.S. are metabolically unhealthy. And again, these numbers, you can find them, you can Google them. These are not made up. It's 88%. And 50% are either pre-diabetic and or diabetic. And that is high. And it's all due to our lifestyle.
Correct. It really is. And again, that's why we need to take into account what we're consuming. And like we mentioned, it's the sugar that's leading to all these cardiovascular problems, and we need to fix that. Very important. So
sad. There is some information. It's somewhat current. I don't know how long the info has been up there, but you can find it on the CDC site. But what's very interesting to me, because right now everyone's talking about COVID, and COVID is like the #1 killer. It is not. The numbers that just came out as the #2 things or killers, you know, of individuals in the U.S. One is heart disease, and the number there is 690 million. Okay. Died from cardiovascular disease. 598,000 died of cancer, which is also linked to your lifestyle and sugar.
Correct.
And the COVID numbers, or the deaths, were only 345,000, which we're not minimizing the deaths. Absolutely not.
I want them to know that we're not being insensitive to what is happening.
We are not. But the first two, the cardiovascular disease and cancer, are still the #2 killers of humans. And those numbers are mind-blowing, honestly.
They sure are. And that, again, all linked to our lifestyle mainly. And this carbohydrate consumption.
COVID, we don't hear about this often, but we have heard some people, some doctors come out and talk about this, is that COVID is also linked to our lifestyle. You know, if we are an individual that has any of these other chronic conditions that we've talked about before, well, then we are going to be more susceptible in catching COVID.
And not being able to clear it.
And not being able to respond correctly. Our system, our immune system is not going to be able to respond.
Just to let the folks know, 15% of cases of COVID have gone on to be complications and even death, and 85% usually clear it with minimal symptoms, and that's mainly people who are metabolically healthy.
Okay.
So that's why we mentioned that in the previous video.
Yeah, absolutely. I mean, those are numbers, you know, that we need to hear and learn about, because it makes a difference as to what we need to do if we're not already doing it. We need to get to those changes. Is there anything else you want to add? We will have another video talking about specifically about the good oils and the bad oils that, you know, we can use, you know, to cook with. But we want to keep that separate so that, you know, this is specifically targeting the, you know, what our triglycerides are, you know, and how we can, or what we can do to improve those. So is there anything else you want to leave the audience with as far as this risk factor?
Well, within about 3 days, if you go on a low carbohydrate diet, you can reduce your triglycerides.
3 days?
In about 3 days. So the important thing here is we need to reduce the sugar, the processed sugar, the starches, to bring down those triglyceride numbers, putting our ratio of triglyceride to HDL in a healthy range, 2 or less, putting us in a less risk factor for cardiovascular disease. And again, the typical lipid panel that your medical provider will order for you, you can look at it, you can do the number yourself, and you can get that ratio, which will be a better predictor of risk factor for cardiovascular disease, more than total cholesterol. We'll talk about that more in other videos.
Well, great. Thank you so much. I hope you enjoyed the video today. Again, this was risk factor number 2 in no particular order. We talked about triglycerides, and we will have more information on other risk factors, but also a separate video on the good and the bad of oils. Thanks.